Pain management in the ICU is a critical aspect of patient care that requires a delicate balance of medication, monitoring, and communication. The first step is assessing the patient's pain level. This is often done using a scale from 0 to 10, where 0 means no pain and 10 represents the worst pain imaginable. It's essential to ask patients about their pain regularly, especially after procedures or changes in their condition. Once we have a clear understanding of the pain level, we can tailor our approach. For many patients, opioids are a common choice. Medications like morphine or fentanyl can provide significant relief, but they come with risks, including respiratory depression. Therefore, continuous monitoring is crucial. We often use a combination of pain medications to minimize side effects while maximizing relief. This might include non-opioid analgesics, like acetaminophen or NSAIDs, which can be effective in managing pain without the risks associated with stronger opioids. Another important aspect is the use of adjunct therapies. Techniques such as nerve blocks or epidurals can be incredibly effective for certain types of pain, particularly after surgery. These methods can provide targeted relief and reduce the need for systemic medications, which can lead to fewer side effects. Communication with the patient is vital. In the ICU, many patients may be intubated or sedated, making it challenging for them to express their pain. This is where we rely on nonverbal cues. Observing facial expressions, body movements, and physiological signs like increased heart rate or blood pressure can provide valuable insights into their pain levels. We also need to consider the psychological aspects of pain management. Anxiety and fear can exacerbate the perception of pain. Therefore, providing reassurance and involving patients in their care plan can help alleviate some of that anxiety. Techniques such as guided imagery or relaxation exercises can be beneficial, even in an ICU setting. Finally, we must remember that pain management is not a one-size-fits-all approach. Each patient is unique, and their pain experience is influenced by various factors, including their medical history, psychological state, and even cultural background. Regularly reassessing and adjusting the pain management plan is essential to ensure that we meet the individual needs of each patient effectively. In summary, effective pain management in the ICU involves a comprehensive approach that includes thorough assessment, appropriate medication, adjunct therapies, vigilant monitoring, and compassionate communication. By focusing on these elements, we can significantly improve the comfort and overall experience of our patients during their critical care journey.